Okay, hello, my name is Amanda. I'm a nurse practicing student, and today I am performing a GIGU assessment on a 17-year-old female. For this assessment, I would use ICD code Z00.129, which is the normal routine well visit exam code for this age group without abnormal findings. For this specific exam, we would check vital signs first before getting into an exam. Normal vital signs for this age group include a blood pressure that's 90/60 or between 120 and 80. Heart rates for this group would range anywhere from 60 to 100, and then respiratory rates, the normal would be 12 to 20 breaths per minute. Next, we would move on to just observing the abdomen. So is it okay if I perform an abdominal exam on you? Okay, I'll have you lift your shirt up for me. First, with observation, we just want to make sure that the skin is free of any rashes, any lesions, any obvious masses or bumps, which it is. Her skin is normal color for her ethnicity, and there are no discolorations anywhere. Next, we would move on to the shape of the abdomen. It's symmetrical on both sides. There's no distension, no indentation anywhere. So the abdomen is symmetrical. With knowing that observation is normal, we would then move on to auscultating the bowel sounds. We'll start in the right upper quadrant and work clockwise around to the lower quadrant of her belly. So here we're listening for any hyperactive or hypoactive sounds. So we'd start in the upper right quadrant, then move to the upper left, and then lower right. We would listen for about 10 seconds or so to make sure we get a good hearing on the noises. Hers are normal active, so we know motility is normal throughout all of the quadrants. Next, we would move on to listen to vascular sounds. We would start with the aorta. So we would position our stethoscope a little bit above the belly button. We're listening for any sounds from the aorta. Next, we would move on to the renal arteries, which sit midline with the belly button. We would listen on the right, and then the left, and then the iliac arteries, which sit a little bit below the belly button on the right, and then the left. Here we're listening for any kind of bruits or swooshing sounds within these arteries that could indicate a bigger problem, and we don't hear any sounds, so this is a normal exam. Moving on, we would start to percuss the abdomen, listening for any changes in percussion sounds throughout that could indicate a mass. We're going to start with just general percussion, which is going to start in the right upper quadrant and then move to the left and then down lower like we have been doing. So use my fingers and just tap in each quadrant. I'm listening for tympanic sounds, which is normal. And then while we are percussing that area of the abdomen, we would then percuss also for the borders of the liver, which is on the right upper quadrant area. So we would start just below the rib cage and move down until you hear a dullness that indicates the border of the liver. We would then move over to the left side and percuss for the spleen. So we would start lower for this one and then move up, listening for the dullness change that indicates the border of the spleen. While we're here, I would have the patient stand up and test for any CVA tenderness. So if you don't mind standing. CVA is assessed with the bottom of the rib cage closest to the spine, and you just put your hand on the rib or in that area and tap your hands to test for any kind of tenderness from the patient that could indicate any kind of kidney issues. Our patient doesn't have any tenderness, so I'll have you sit down. After percussion, we're going to move on to palpation of the abdomen. So we're going to start with just light palpation in all areas, going clockwise in our quadrants. So light palpation, you're just testing for any superficial tenderness. Our patient doesn't have any. And so next we would move on to deep palpation in order to feel more of the organs as well for any masses. So deep palpation is just a little bit more pressure that we're adding to all the quadrants? Any tenderness? Okay. And then now that we know that there's no tenderness throughout, we want to check for an aortic aneurysm. By doing that, we're going to place our hand just above their belly button and feeling for any kind of pulsating mass above the belly button that could indicate an aneurysm at that time. We also want to palpate the liver and the spleen while we're here for any kind of tenderness. This would use deep palpation as well. So the right upper quadrant, we would palpate the liver right below the rib cage. Any tenderness?
No.
And then for the spleen, we're going to go to the left. Same sort of palpation. Any kind of tenderness?
No.
Good. So this is a normal finding, no pain. If I did have a patient that expressed any kind of tenderness in a specific area, we would look for rebound tenderness, where you would palpate in that specific area and then take your hand away quickly to test for any kind of pain expression. More specifically, if you have a patient that expresses any pain in the right upper quadrant, that could be indicative of maybe a gallbladder inflammation, then we would want to use Murphy's sign, where we do deep palpation to test for the tenderness, and then watch the patient's breathing if they hold their breath, or if they express any pain on their facial expressions that could indicate problems with their gallbladder. That's called Murphy's sign. Next, we move on to the orbiter test to test for the lower, specifically the appendix, any kind of tenderness there. So I would stand on the right side of the patient and lift their right thigh up and rotate it around and assess for any kind of tenderness in that area. From there, what we would do, we would be done with the abdominal exam and would move on to the GU portion of the test, so you can actually lower your shirt if you'd like. For this, because my patient is a female, what I would look for is double checking that the skin on the vagina as well as the labia are free of any swelling, any lesions, any rashes, or abnormal discharge, or even any tenderness or pain down there. If I had a male patient of this age, I would want to test the scrotum as well as the testes, palpate for any kind of tenderness or pain, as well as inspect for any kind of abnormal rash, any kinds of lesions, or any swelling or discharge. For both male and female in this age group, I would expect them to be in Tanner stage 5 or have already completed Tanner stage 5, so full puberty would be complete at this time.